The health of America's elderly, challenges, progress, and the road ahead. As the United States continues to age, the health and well-being of its elderly population have become a central focus of public health discussions. By 2030, 1 in 5 Americans will be over the age of 65, creating both new opportunities and pressing challenges for the healthcare system, social services, and families across the nation, a growing demographic with complex needs. The elderly in America are a diverse group, ranging from active seniors in their 60s to frail individuals in their 90s and beyond. Aging brings increased risk of chronic conditions such as heart disease, diabetes, arthritis, dementia, and cancer. According to the CDC, nearly 80% of older adults have at least one chronic health condition, and 68% have 2 or more. Additionally, the physical effects of aging, such as decreased bone density, reduced muscle strength, and slower cognitive function, can affect mobility, independence, and quality of life. These changes often require a multifaceted care approach, involving medical support, mental health services, and long-term care planning. Mental health and loneliness. One of the most overlooked aspects of elderly health is mental well-being. Older adults often face isolation due to the loss of spouses, friends, or family members, and many live alone. This isolation can lead to depression, anxiety, and a sense of purposelessness. Studies show that loneliness is linked to higher rates of cognitive decline and even premature death. Mental health care for older adults is underfunded and underutilized in many parts of the country. Stigma, limited access, and a shortage of geriatric mental health professionals exacerbate the issue. Financial strain and healthcare access. While programs like Medicare provide essential coverage, many elderly Americans still struggle with out-of-pocket expenses for prescriptions, medical devices, and home care. Those on fixed incomes may skip treatments or medications to save money, which can worsen their health conditions. Healthcare access is also uneven. Rural areas, where a significant portion of the elderly reside, often lack nearby hospitals, specialists, or transportation options. This can delay diagnoses and treatment, leading to preventable complications. Innovations in elderly care. Despite these challenges, innovations in elderly care are emerging. Telemedicine has become a crucial tool, especially after the COVID-19 pandemic, allowing seniors to consult doctors without leaving home. Wearable devices now help monitor heart rate, glucose levels, and falls in real time, providing peace of mind for both seniors and their caregivers. In urban areas, senior wellness centers offer a mix of exercise classes, health screenings, and social activities aimed at promoting active aging. At the same time, advances in Alzheimer's research, cancer treatment, and orthopedic surgery are giving older adults a longer and more functional life. The role of caregivers. Family members, especially adult children, are the backbone of elderly care in the U.S. However, caregiving is often unpaid and emotionally taxing. It requires time, patience, and sometimes financial sacrifice. The country's increasing reliance on informal caregivers underscores the need for more support systems, such as caregiver stipends, respite care programs, and expanded home care services. Professional caregivers, including home health aides and nurses, also face challenges, such as low pay, high demand, and emotional burnout. Investing in training and fair wages for these workers is essential for the future of elderly care. Building a healthier future for seniors. Creating a healthier environment for America's aging population will require coordinated efforts on multiple fronts. Policy reforms to expand Medicare coverage, control prescription drug prices, and incentivize healthy aging programs. Community support through affordable housing, accessible transportation, and senior-friendly infrastructure. Education and awareness to promote preventive care. Vaccinations and mental health outreach among older adults. Technology integration to make health monitoring more efficient and empower seniors to manage their conditions. Conclusion. The health of the elderly is not just a personal issue, it's a societal one. As more Americans live longer, ensuring they do so with dignity, vitality, and care is both a moral and economic imperative. The U.S. must adapt its healthcare system, policies, and cultural mindset to meet the evolving needs of its seniors. A healthy older population is not only possible, it is essential for a thriving, compassionate nation.